good impressions. The digital technology do not compensate for analogic mistakes. It's very important to know what the patient wants. If what he wants is really what he needs, and if we can really do what he wants. I think that immediacy is important for the patient. He leaves the surgery already with his teeth. It's very rewarding for the patient. He doesn't have to come in more than one appointment for this result. We are running this study with 4mm implants for edentulous full arch, and we are very excited because we just had the results from the primary stability, and it's comparable to conventional implants. ISQ values are over 70, that is excellent.